How you doing again, guys? It's Dr. Chris, and we're going to discuss a few other treatment options that we do in the clinic. This one is called flossing. There's a lot of different companies out there. Gluten Floss, for example, another great product. FAKTR itself, which I use, which I'm a part of. I'm a FAKTR provider, besides an ART provider. Comes up with their own brand here. So what we're doing is we're doing a lot of deep ischemic compression when we're dealing with any type of chronic sprains and injuries with the joint. This is something that has come out from the gym, but a lot of research has been coming out more with it too. But a lot of it really is basically just almost kind of similar to blood flow restriction, but not in the sense we're trying to restrict blood flow. That's not the purpose. It's really meant for extreme myofascial ischemic compression into the joint area where there's a lot of myofascial restriction involved. So take, for example, Coach Dillon here has got an issue with his knee, a chronic issue. So now we're going to go ahead and start wrapping with the FAKTR floss. So it's literally just, if I'm going to try, let's see, where's the issue? Or is it just in general?
I would say it's kind of like around this area-ish, and then in the back.
In the back.
One of those.
So a lot of times I may target it going through here. For example, I'm going to go right at this area, wrap it around, make sure it's actually tight. Now, a couple of things that I will say though is that this can be very uncomfortable on the patient or an athlete that you're working on when we're doing this. We also want to avoid any numbness going down into the joint itself. As you can see, I'm going over and I'm going around the joint itself, making it tight. You okay there, Coach?
Yep.
All right.
So far, so good.
So far, so good. Going around. So there's a lot of different ways to wrap it, making it just nice and tight for him. So for now, whoops.
The last part's tricky.
The last part's tricky as we tuck it in. There's real time, folks, so no editing here. What I want you to do, just like how we do with the ART, we're going to start with the knee and extension as best you can, and then fully flex it as best we can. Okay?
Yep.
Go ahead, keep going. Couple passes. May even have you do as even a squatted position. Good. Now, just for the sake of it, Coach, go ahead and start off. Just do a regular body air squat. Are you doing okay here?
Mm-hmm.
How does it feel? Really tight?
Yeah, it's tight.
Pretty tight?
It's tight.
Okay, go ahead, sit down. And a lot of times, instead of necessarily doing a lot of myofascial or manual therapy work, this is exactly what we would do. To your foot. Okay, stand up, walk around, see how it feels.
Yeah.
Feels pretty loose right now?
It's definitely loose. Definitely loose, even looser than the other leg.
Okay, good. All right, good. All right, so that's basically flossing. So we do this a lot with our joints, whether it's elbow, wrist, shoulder, knee, ankle, not the neck, because obviously we do not want to cause any type of choking or asphyxiation to the neck. So that's the only exception there too. So these are a couple of things that we do here. Thanks.